Okay, I would like to introduce today's speaker, Patrick Shaw. Patrick is an associate and licensed clinical social worker with over 20 years of experience as a senior healthcare director. Most recently, he was the director of learning and organizational development and behavioral health services at Northside Hospital in Atlanta, Georgia. Patrick maintains a private practice in Lawrenceville, Georgia, and is an adjunct professor for the University of St. Francis and associate professor for the University of Phoenix. And now Patrick is going to share his presentation on dual relationships, balancing your role as leader and friend.
Okay, as we get started, Leslie, can you hear me okay? Leslie?
Yep, I can hear you just fine.
That's what I needed to see, this next slide. Okay, hang on one second. Okay, so our topic this afternoon, as Leslie said, is dual relationships, balancing your role as leader and friend. I'll speak as loud as I can. I have the volume turned up fairly loud, so hopefully everyone can hear me. Our objectives, as you can see this afternoon, we have a handful of objectives. Those of you participating will receive tips for first-time bosses. Some of you may be bosses for a while. Some of you may be bosses for the first time. We're going to list 4 strategies for transitioning from peer to boss. Again, some of you may be just taking on your role for the first time, and you may be actually supervising people that you were once colleagues with. Participants will utilize an assessment tool to determine the strength of their team. We're going to look at the 4 stages of group dynamics and manager strategies to use for each of these stages. I'm going to share with you the departure risk matrix, which is a nice tool to be able to use to determine team engagement. We're, of course, going to look at the special challenges of dual relationships. And finally, 8 strategies that managers, both seasoned and new, can use to be effective. This next slide we're going to pass right through, as Leslie already did the introduction. So let's go ahead and start with what is the role of a supervisor. And as I talk this afternoon, I'm going to use the term supervisor, manager interchangeably. I'm basically talking about anyone who supervises other people or has direct reports. So as we look at the definition of the role of a supervisor, we can see that a supervisor is a person who directs a team or athlete, or secondly, a person who is in charge of the business affairs or training of a group. And then as you can see, I added my own definition, which is see also circus juggler. Because as you can imagine, or if you've been a supervisor, that sometimes being a supervisor, you can feel like a circus juggler. You can feel like the person who you've seen before who has those plates spinning on the bamboo poles and just keeps running and trying to not to let any of those plates fall and crash and hit the ground. That's how our days can sometimes feel like as we supervise other people's. We have departmental responsibilities, people responsibilities, hospital responsibilities, that we're juggling all these different kinds of things. I remember recently I was in Athens, Georgia, and they had a show on the sidewalk, and someone was juggling those bowling pins, and it's the same kind of thing. You just keep adding more and more to the responsibilities you have, and it feels like you're working as hard as you can not to let any of those drop. So again, when we look at the role of the supervisor, we're talking about someone who directs a team or business affairs of others, but also is probably juggling a lot of things as well. Some of the things we juggle as a supervisor are roles, resources, projects, priorities, and problems. In terms of roles, as a supervisor, any given time, you're going to be responsible for managing other people. You may be working with patients. You may be coaching employees. You may have the role of marketing, conflict resolution. You may be responsible for QI activities or joint commission preparation. So you're constantly juggling different roles. You're wearing different hats. You're having to switch in and out of hats and roles throughout the course of the day, and sometimes rather quickly. You may be dealing with an employee at one time, and then you get a patient complaint or someone who has an issue with their computer and they can't log on, for example. So you're constantly juggling these different roles. You're also juggling resources. You have a limited budget. So you're juggling your budget dollars, you're juggling equipment, you're juggling people. People I look at in terms of a resource. You're also juggling a lot of projects. Most supervisors, or the ones I know and have worked with, have more than one project going on at a time. Very rarely do we have one project that we can focus our entire time on. We're juggling different projects as well. We're also juggling different priorities. We have our departmental priorities. We have the strategic goals of the hospital. We have crises that show up. You may come in one day and have your day pretty well planned, and so you have call-outs, you have extra volume of patients, you have scheduling issues. So you're constantly juggling priorities, and the priorities may change. What was important when you came into work, in the morning that you're taking care of may switch in the afternoon because you have something pretty big come up. For example, maybe an employee relations issue or a patient complaint. So you're constantly juggling priorities. And lastly, of course, we're juggling problems. We're juggling people problems, equipment problems, those things that we plan for, the unexpected. So we're constantly juggling problems. So as a supervisor, how do we determine what is the number one role for us in our position? If we ask Zig Ziglar, who is a motivational speaker, and some of you may have heard in the past, Zig Ziglar says the number one function of a supervisor is to bring individuals together to work as a team. If we were to consult with and ask Ken Blanchard, who you may be familiar with as the author of The 1 Minute Manager and other books, he says the number one function of a manager or a supervisor is to gradually increase the competence and confidence of your people so that you can begin to use less time-consuming styles and still get high-quality results. So what he's talking about is increasing the competence of people so that we can move from a directive style where we're pretty hands-on with people, telling people what to do, to a much more of a delegative style where we can let go of responsibilities to some of our staff and therefore focus on some of the things we need to do as a supervisor. The goal really is to increase the competence of our team so that we can focus on our new responsibilities. If we ask Don Shula, who is a former head coach of the Miami Dolphins football team who went 17-0, he says the primary responsibility or the number one function of a manager is to be a coach. One of the things we're going to be talking about in one of our later slides is really that the number one function as you transition from an employee to a manager is getting results. So how we're viewed by the organization as an employee is viewed differently as a manager. Our job as a manager is to get results, and we get results by utilizing the people on our team. It's not dumping on people. It's really bringing people up to a competence level where we can use less, again, directive styles of managing and more delegative styles. I also think it's important, as part of defining the number one function, is knowing ourselves. I think it's important for all of us in management to ask ourselves, why do we want to be a manager? Why do we want to supervise other people or have the responsibility of other people and a department of people? Some people are very comfortable with that. Some people really prefer not to have that. They might want to be a manager or a director, but they don't want the responsibility of other people. So, as we ask ourselves, why do we want to be a manager? Is it because I think I can do the job better? Is it because I get some extra money? Is it a title that maybe I want? Without knowing why we want to supervise, we may be taking a trip without an idea of where we really want to go. So it's an effective strategy for someone who's very adventurous, but it's not a very effective management strategy. In fact, for anyone as a director, when I had direct reports who were also like supervisors and managers, one of the early discussions I always had with them was, tell me a little bit about why you want to manage other people. Why do you want to be responsible for other people? And if they didn't know at the top of their head, I always, assign that as kind of a homework task, and we'd follow up in a week or two, because I really think it's important for us to look at that we have a responsibility for other people and what is our motivation behind it. Again, going back to Zig Ziglar, our motivational speaker, he states that management assumptions plus our management attitude equals how we behave. In addition to this, I would say we also need to be technically sound. So what do we mean by management assumptions? Management assumptions or management beliefs about people is, what is our beliefs about people's motivation? What do we believe about trusting our employees? Our employees' willingness to do a good job? That's what I mean about management assumptions. Or I also use the term management beliefs. Management beliefs have also changed over the years. It used to be where we just looked at employees as maybe someone who came to work that we really needed to supervise, and it was all about work, but the beliefs have really changed. There's an article in Business Week that state that companies are realizing that there's a strong connection between work and family, and companies are trying to be more family-friendly to increase the loyalty and productivity of their employees. If we look around different hospitals or different companies, we hear hospitals or companies talk about wanting to be the employer of choice. Hospitals or organizations want people to come to work with us, but part of that is realizing that people have a life outside of work and really trying to help them balance their work life with their family life and being much more supportive of the outside life. There's also another changing belief about management. It used to be that employees would join a company and they plan to be there pretty much for their entire working career. But obviously that landscape has changed over the last number of years, and there's a lack of loyalty and trust between the company and their employees due to layoffs, mergers, acquisitions. So there's a lot less trust. More and more employees are coming to work for an organization, but they're also thinking about taking care of themselves. But because they've seen 100% loyalty to the organization may or may not benefit their career as they see people get laid off or their friends get laid off or people lose jobs due to acquisitions or mergers. Employees are also thinking, and this has happened over the last number of years, more in terms of what they want to do for their career. So people are choosing sometimes to leave certain occupations that might be a lot of responsibility or high stress to focus more on things they really want to do. For example, working for themselves or working for a smaller company versus a bigger company. So that's what I mean about management assumptions and how we, what our assumptions are as a manager affecting how we manage employees. And this is really key to our next couple slides. There are three different types of management theories. Theory X was developed by Frederick Taylor, and he talked about the negative management assumptions, which we'll go into more detail in just a second. Secondly, Douglas McGregor, he talked about and developed Theory Y, which is more positive management assumptions. And then finally, Dr. William Oche, he talked about or developed Theory Z. And again, we're going to look at these more because, again, these theories really reflect kind of how we believe our employees are and affects how we manage. So, for example, Theory X, negative management assumptions by Frederick Taylor. Frederick Taylor assumed that employees are expenses and not investments. He says that control must be centralized to ensure that employees do things the right way, which is the way management says they should be done. He says that management's primary duty is to control costs, monitor employee work methods, and assure immediate productivity or profits. He says that basically that workers are basically unmotivated and probably dishonest if the opportunity presents itself. That motivation for employees is primarily done through rewards and punishments. He also believed there is one best or standard ways of performing the job, and it was the management's duty to define what that was. He assumed that subordinates or direct reports dislike work, they lack motivation, they're set in their ways, and they need to be led. That people inherently dislike work and will try to avoid it, and it's the manager's job to coerce, control, and direct every move. The assumption here is that employees have an external locus of control, that is, they need someone else to control themselves at work. The typical example when you think about this is the old factories where people came to work, they got on an assembly line, everything was dictated how they did, the brakes, how everything was assembled, there was always someone watching over them, there was very little lack of recognition, and there was generally punishment as a way of dealing with people's behavior. If you think back over your career, you may have actually worked with people or with managers who have been under supervisors who did have negative management assumptions. They assumed you needed to be micromanaged, heavily directed, heavily controlled. I had a person I was talking to, in fact, just the other day, and he was telling me about his job. He's new to the country. And I was asking him how he liked his job. He said the job was sort of kind of okay, but somewhat boring. He's been doing it for a while. But what made it really stressful for him, he was saying, is that he has a manager who is very controlling, very patronizing, very condescending. So he said, and he was talking about work stress, is that made his job really, really difficult. And he was thinking about other things he could do. So again, even though this sounds like maybe somewhat of an antiquated or older way of assuming or making assumptions about people's behavior, it still occurs today. And again, this is an example. I was just talking to someone just a couple of days ago. And again, if you think back over your career, you've probably met some managers, worked for some managers, or worked under some managers who had a negative assumption about you and your work habit and your employees. On the other end of the spectrum, we have Douglas McGregor, and he talked about positive management assumptions. He saw work as being natural as play, that people are committed and creative. He thought that subordinates were willing to work. They want to do a good job. They come to work. They want to exceed. They want to excel. They want to be the best. He saw employees as taking responsibility for their actions. They were capable of intrinsic self-direction and control, that managers didn't have to just totally supervise them, that people could do a good job. This is where self-guided teams came into work. These people were, as in his assumptions, were inner-directed or had an internal locus of control. Again, if the manager wasn't there, they would still do their job. They would show up on time. They would clock in on time. They would do a good job. They would take their breaks on time, but also return from their breaks on time. He saw employees as being creative and innovative if properly motivated, and the manager's primary responsibility was to reward, recognize, and be fair and consistent. So again, thinking back over your career, you probably have people that you've worked with under who had a positive management assumption. They thought that you wanted to do a good job. They supported you. They rewarded you. They assumed you would come in every day and put forth your effort. Again, as we take on the role of a manager, our assumptions affect how we treat employees and how we behave as a manager. The last one, again, coming from Japan, is Dr. William Ochi, and he saw the theory Z as decision-making is typically consensual, meaning group, and participative, meaning people work together and make group decisions. There is a broad concern for the well-being of employees as a natural part of the working relationship, so again, thinking about the employee, but also thinking about their family. Flexibility and freedom are intrinsic. Workers can work without close supervision. The key to all of these three assumptions, whether it's a negative management assumption, positive, or theory Z, is realizing that our assumptions determine how we treat employees. I know a nurse manager who was a micromanager, and we used to get complaints about her. She would be very directive. She would send emails in caps, bold, and red. People would try to talk to her, but she inherently did not trust her people to pay attention to her, to do a good job, and she felt she needed to be very controlling in terms of how she did that. There was also a time where we were, myself as the director of training, we were doing an off-site retreat for managers, and we talked about reward and recognition programs and the importance of recognition for employees. And we had a director stand up and really question us about that. And the director, and this was within the last couple of years, basically said, why should we recognize employees? Because they do their job. They have a job description. They do it. There's no reason that we really need to recognize them for their work. So again, these management assumptions, though they may seem somewhat outdated, really occur, even in present situations. So now let's turn our attention from making a transition from a peer to a leader. And again, it's important to ask ourselves, why do we want this new role? To clarify our beliefs about the role and to be open for our feedback from others. So we're going to be talking about 4 strategies over the next few minutes about transitioning from peer to leader. Accepting your new role as a leader, setting clear boundaries with people we supervise, communicating with people, and taking action. The first is accepting your role as a leader. Basically, as we move into a leadership position, we're giving up membership in one club, which is a non-management employee, and joining another club, which is leaders. You are now one of quote-unquote them. You are management, whereas you might have been in a group of people who talked about management. You, as a leader, are now one of them or as a manager. Your allegiance must be to the organization and its goals. Whereas before, you may have colluded or complained about changes. Now your role requires you to get on board with the changes. So where in the past you might have been over a coffee break, lunch break, or off-site, talk about some of the difficulties of work and complaining about it. Now, if you're a leader and you're with this group of people, your job really is to get people on board with the changes and not collude and participate in the complaining. Your role has also expanded, so it's important that you know key people in other departments. It's important that you develop a new management peer group so that you have people that you can talk to about situations that might be difficult or situations you may disagree with or have concerns about, that you talk to the other managers about this situation and not your direct reports who may also be your friends or peers. Historically, the person with the greatest competencies or skill was promoted and not given much training in their new roles. So, for example, the skilled or most competent RN might become the manager, or a skilled electrician became the boss. Now organizations are moving to providing much more training and realizing that training is essential for you to succeed in your new role. Also, as a leader, your value is not just to you, but to your department and getting results through other people. And we'll talk about this as well down the road. How do we get results through other people? How do we succeed by helping other people succeed? It's also important to realize that supervisors supervise people. A sizable portion of every day is people management. We also need to have other skills, for example, planning, budget, project management, communication, up and down the organization and team building, but a lot of our day is spent managing people. It's important for us to ask for help from others, from our boss, from human resources, from colleagues, from legal, from risk management. But as a manager, and we talked about this, those of you that attended last week, that as a manager we don't have to know everything, but we should get help for those things we don't know. A common concern sometimes comes up is, do I have to give up my coworker relationships? Well, the answer to that is no. We can still keep our coworker relationships if we had peers and now we're the supervisor of those peers. However, you and the friends that you have must accept that your relationships are different at work. You're now their boss, you're their supervisor. It's important that we don't show favoritism or special treatment for friends at work. So yes, we can still be friends with the people we used to be colleagues with that we now supervise, but we do need to talk about, and then we're going to get to that, about communicating clear boundaries and limits with people. Accepting your role as a leader also means becoming a learning machine. We need to know policies and practices. It's important for us to take classes. It's important for us to find a mentor. And it's important for us to learn the business of business. And what I mean by the business of business, what's really important and why? What are the highest priorities of the organization? For example, as a nurse, your highest daily priority might have been taking care of your patients, those that you were assigned. As a manager, it's ensuring that all the nurses under you are taking care of all the patients all the time. So your role has expanded, and that's what we mean about the business of business. What is the highest priority to the organization? Am I doing things to help meet those priorities? Sometimes as we take on a new role, it can be very challenging. It would be very easy for us to want to jump back into our previous skills that were much more comfortable. We want to avoid this trap. We do not want to do our employees' jobs. We can help out, but we don't want to make it a regular habit. In fact, this is one of the things that came up in a class we were training. We talked about the difficulty of transitioning from a peer of a group to becoming a leader of that group, and one of the people in the class says one of the challenges for her was she knows their job so well, it's easy for her to go back to that comfort level rather than dealing with some of the things she was less comfortable with, which was maybe, for example, people management or budgets. And through discussion, she knows it's her job that she can't do that, but so it's important for us not to slide back into our previous role. We want to model behavior that we expect from our direct reports, again, remembering that we're always on stage. Our employees are always watching us to see what we do, if we're consistent by what we say and what we do, and that some previous behaviors that we may have engaged in may need to change. For example, we may have talked about or complained about management or policies or the direction of the hospital. We now are an agent of the hospital and need to help our employees support that as well. So our role and our message has changed too. We don't want to question the organizations or our policies. We said this earlier with our direct reports. If we're unsure about something or we disagree with a change, we want to ask our boss or colleague or one of our colleagues. We want to avoid pity parties, which may be complaining sessions, which we may have joined in previously. Accepting responsibility also means not passing the buck. When in doubt, ask or get help. We're not expected to know everything, but we are expected to know who to ask about things, just as you would if it was, for example, a nursing procedure or a new HR policy or a new standard coming down from Joint Commission. If we're unclear, we do ask and get help. Secondly, it's important for us to set clear boundaries. We need to clarify our expectations. What can our employees expect from us? But secondly, what can we expect from them as well? As we set boundaries, we're establishing our position as a leader who is committed to managing effectively. Setting boundaries also reinforces the need for employees to perform well. We're giving them a roadmap to perform well. Setting boundaries also helps former peers understand the nature of your relationship with them. So again, if you're a peer and now you're their boss, setting boundaries helps them understand your new role as well. Setting boundaries at work and outside of work, especially in smaller organizations, but when you become a leader of peers, you still know those people. You still may be in the same, for example, church choir. Your children may be on the same team. You may see each other in stores, clubs, tennis teams outside the organization. And that can be challenging, especially in smaller hospitals. In Atlanta, I worked for a hospital which was part of a 3-hospital chain. One of them was probably 40 miles up the road, and much smaller where people had cousins that worked there, they had family that worked there, their mom may have worked there. So that makes it much more challenging. But again, we need to set boundaries with people that we can still have those relationships with people outside of work. We just need to be very clear about what the limits are, what things we can discuss, what the boundaries are. For myself, I was responsible for a couple different departments, and I was very clear about, the amount of time I would spend with people outside of work, whether it was someone's birthday celebration or people were going out to do things. Again, setting boundaries is real important. We want to clarify any changes. As you take over, you may actually make some changes from the previous person who was in that position. I was a peer one time when I took over a department, and now I supervise the people that I was a colleague with. And one of the first things I did was introduce flex times or 4 10-hour days. This is something I talked about with them when we were all colleagues or peers, and we had a different boss who was not supportive of that, but that was one of the things I did change. So it's okay as we take over to change policies. We just need to communicate what those are. And again, we need to realize that rules and guidelines are meaningful only if they are followed and people are held accountable. Stating your expectations is only half the battle. The other half is delivering on what you tell employees to expect from you. So, for example, think about parenting, those of you that have parented before. If we tell our children one thing but we don't follow through on it, for example, we're going to take your cell phone away or your computer away or you're grounded for a week, but within a couple days we give in or we don't follow through on it, they're going to be less likely to follow through with us next time. It's the same thing as we supervise in employees. When we state our expectations, we need to follow through and hold people accountable. We must address any violations of policy or procedures immediately. Sometimes new supervisors turn their eyes on something and quote-unquote hope things get better. It doesn't, and frequently gets worse. And we had a lot of supervisors talk about this in class when we did new supervisors training. It's important for us to attend to concerns in the organization immediately, that if we don't, things generally do not get better. We said this earlier, we don't want to share confidential information with direct reports. For example, as a manager, you're going to be privy to confidential information. It might have to do with a departmental move, a departmental consolidation, a layoff, and these are things that we need to keep confidential from our employees, even though they may be a friend of ours. It's important for us not to let friendships come before business. It's a fine balance. I know for myself one time I had a situation where I had to terminate an employee. And this is someone that he and I worked together back in 1984 on an adolescent psychiatric unit. Then our careers went different ways, but over the course of the time, we kept in contact. He came to my wedding. I knew about his. He came to my graduation. I went to his when we got our master's degrees. And eventually he came to work for the same organization I did within my division at 2 levels down, so it was okay for him to work there. And it came up to a situation where he did something and it required that we terminate his employment. That was a really difficult situation. He's a good friend of mine. I knew he needed a job. But because of his behavior, we had to terminate his employment. Fortunately, we've stayed friends since then, and we're okay about it. So, again, setting clear boundaries. Also related to boundaries, something that a lot of new supervisors do is they become their employee's counselor. And we don't want to do that. We want to refer them to an EAP service or whatever counseling services are available to your organization. It's okay for us to listen to employees, especially if they're friends of ours, to be supportive, but we don't want to be their counselors. Because that's going to put us in a really, really bad bind. We also want to treat all employees fairly and consistently. The third strategy is communication. And communication is at the very core of people management. We must communicate clearly up to our people above us, across, and down. It's important for us to keep people informed, especially when there's any type of delay, any type of concern, any type of feedback or setback. And when we talk about communication, we're talking about verbal communication, voicemail, email, text, notes, memos, reports. I also encourage new supervisors to be careful about how you write memos. We want to keep them professional, not conversational, especially for supervising friends. People may assume, well, yeah, I've worked with these people. They used to be my colleagues. Now I'm a supervisor. I can be pretty conversational. We want to keep those types of communication very professional. And you can see listed here a lot of different things we communicate, or reasons we communicate, from informing people about what they need to do, to clarifying expectations, roles, and responsibilities, to coaching people to success, to correcting performance and behavior problems. And if you look at the last one, some of you have probably heard of this, WIIFM means what's in it for me. So when we communicate to employees, it's important for us to give some background, some of the business case for any type of change that might be going on, rather than just putting up a memo about the change. I had a manager who worked for me one time, and he had a very directive management style, somewhat of a negative management assumption. And he would send out memos about changes, and they would be, don't do this, don't do that, don't do that. And the tone really put people off. So I worked with him about ways to approach this. You know, before we just tell people why you can't do something, give them the business case about why we're making that change. So again, what's in it for me as the employee as we communicate information? This one I always like. If you read the statement to yourself, or if you're in a group of people, I never said you stole the money. Let's read this statement and put the emphasis on the word I. So it becomes, I never said you stole the money. Now let's put the emphasis on the third word, said. I never said you stole the money. Or let's put the emphasis on the word money. I never said you stole the money. So if you look at this, or if you read it to yourself, or if you read it to the group of people you're with, it's 7 words read 7 different ways with 7 different meanings depending on where you put the emphasis. The point of all this, of course, is that our tone is really important. Our words are really important. What words we bold, highlight, capitalize are really important in terms of communicating the message. Again, these 7 words have 7 different meanings depending on intonation. People have also said that 70 to 90% of our communication is nonverbal. So as we communicate with people, people are watching our body language, our tone, our facial expressions, and seeing if there's congruence. And if there's not, then what they're going to believe is more your body language than our spoken words. So this is something you can have fun with your group of people if you want an exercise on communication. Just put up the words, "I never said you stole the money," and ask people to read it, but put emphasis on a different word. The last strategy of the 4 that we're talking about is take action. We talked earlier about becoming a supervisor and what you're measured on. The ultimate criteria for measuring management effectiveness is results. That's what the organization is looking at us to do as a manager. They're looking at us to get results. Now, if we take a team of people will perform at a certain level even without a supervisor. The expectation, however, is that with the supervisor, the team will perform at even a higher level. Think about a team without a coach. They go on the field, they're going to perform at a certain level, but the assumption is that they're going to perform at a higher level if they have a coach. That's our job, or that's your job as a manager, to get the team to perform at a higher level. In terms of taking action, I heard a story a few weeks ago on a sports station here in Atlanta. And a coach of a football team, a Division I football team, was saying about having new recruits on the field. He tells the story. He tells the new recruits, he says, 3 frogs are sitting on a log, and 2 decide to jump in. How many frogs are left? The answer is 3. Just because someone decides to do something, it doesn't mean it's going to happen. Leadership means action. Our job as a leader is to take action and to get results. And here are some types of actions we take. Problem solving. Things happen, and it's our job to guide or fix them. For example, a patient complaint issue, call-outs, equipment breakdowns, scheduling issues, performance issue. Those are problems that come up, and our job is to fix problems. As a non-manager, you could refer the problem to the supervisor. Now you're that person. So as before, if something came up and you didn't know what to do with it, or you were busy taking care of patients or doing your job responsibilities, you could say, well, you could pass on to the supervisor. We're now that person. Taking action also means implementing or executing a goal, a project, or an end state. Something is assigned to us, and it's our responsibility to make it happen. For example, it might be the introduction of an electronic medical record and getting people on board with charting electronically. It might have to do with increasing patient satisfaction scores or improving retention. We need to execute and take action on those projects. The last area of taking action is decision making. A task, an issue, or conflict has arrived, and it's up to us within our department and requires the decision to be made. That's done by us. We want to take in the information, analyze the situation, weigh the options, apply the appropriate policies, get help, and decide what to do. It's okay for us to ask the people who report to us for input, but ultimately we need to decide what to do unless it's something that's pretty benign. For example, your team may be discussing how they want to handle birthday parties or a holiday celebration. You can turn that over to the team. But again, remember that whatever is done falls under your privy of responsibility. So decision making is the third type of action we take. So some advice and ideas for supervisors. Again, we said this earlier. It's just kind of a recap. Accept the change. Be upfront and honest with people. Employees want to follow someone with integrity. Expect your relationships to change. They are going to change. And again, we talked about clarifying what those changes are, what we can expect from our employees and what they can expect from us. If we don't expect our relationships to change, that's kind of managing with blinders on or our heads in the sand. It's really not paying attention to a dynamic that's definitely going to trip us up if we don't. We want to establish a new peer group. We talked about that. Admitting mistakes if we don't know something or if we do something that we need to change. being ourselves. Again, we're not asking you to change it totally who you are as a manager. You need to be yourself, but manage with awareness if you haven't been. We want to stand our ground. If needed, we want to defend our employees and stand up for them. I know for myself, when I was in charge of the behavioral health division, one of our audits came in, was pretty critical of how we were doing our documentation of goals and objectives. We asked someone to come in to provide some training. My staff asked a lot of questions about that. I had some questions. The trainers were not very clear on that. So we really pushed them to be much more clear. So that was a time where we got dinged in a survey. We didn't score as well as we could, but I felt it was important to get much more clarity in standing up for my department and my team that they did know what they were doing. We just need to connect what the surveyors wanted with what my staff was doing. There was another time, this was a joint commission session, where we had a surveyor look through a record and asked to talk to one of our clients, and this was a behavioral health client. And the client told the surveyor that the staff didn't listen to him, didn't honor his wishes, wouldn't help him get into another house. And she was very critical of us because she couldn't find the documentation, and rightfully so. She should be. Basically, as you know, if it's not documented, it didn't happen. So this is one example where I could stand up for someone because I knew she's a competent employee, and we were able to get a special resolution session the next day. We were able to get the documentation together, and we were able to get by without a problem. So again, standing up for our employees, standing up for our departments. Don't play favorites. Be consistent and fair across the department. Be proactive. Don't wait for things to happen. And do what you say you're going to do. And we talked about that earlier as well. If we follow these things, it helps us focus on the future. It helps us gain credibility as a manager. It helps people trust us in our new role. We should expect that people are going to test us in our new role. They're going to see if we're going to hold to the things we say. So expect that, and we're going to talk about that, about getting tested by our employees. But again, we need to stand firm with the things we say we're going to do. We want to be fair and consistent. For example, if we buy presents for some people at work or give some recognition, we want to make sure we're giving recognition to everybody. We want to be clear about any changes we're going to make. We want to communicate clearly. We want to, again, as I said, be a fair, consistent, and equitable boss. Last couple things, advice and ideas about being a new supervisor that minimizes confusion. Clear communication and expectations decreases confusion, increases produced results. And also remember that your manager who hired you in this position is also watching how you perform, and they want to make sure that they also hired the right person for the job. So your boss is also watching you. So that's why we want to perform, consistently and fairly. This is the whole thing, again, summed up in a grid. Just kind of makes it easy for you to see. You can see over here the 4 strategies we talked about: accepting your role, setting clear boundaries, communicating, and taking action. This is why these different things are important, and we're not going to read them all. These are things we already covered. And then again, why is it important that we do these things? It establishes us as a boss. It clarifies our relationships with people. It helps establish those rules so that we can work together. So this is really just a summary of what we talked about earlier. So as we think about balancing our role as leader and friends, the 3 key strategies, again, is communicating, setting boundaries and limits. We might not be able to do some of the things we used to do with people. If we went out with people for lunch or for a drink, we might want to be kind of cautious about that, or at least be aware. We don't have to stop doing it, but we need to be aware that our role is different. So if the conversation turns to work or complaining about work, that we need to disengage ourselves from that conversation. People may say, or our employees may say, you've changed. You really haven't changed, but your role has. And again, we talked about not reverting back to the previous role. You may be asked to participate in people's graduations, go to people's weddings, their baptism, funerals, other significant life events. And we can continue to do all these things. It shows we're a supportive manager and boss. We just might want to limit our time at one of these engagements, depending on where the conversation is going, or at least be very clear in our role. We can be a friend to a person outside of work, but then we don't want to engage in things with them or behavior or discussion if it gets back to work. I know for myself one time, again, I've only had to terminate people a couple times, which is fortunate, but there was someone who I really liked that worked for me in South Carolina, and he went from second shift, 7 to 3, or 3 to 11 to first shift. He was recently married, he had a baby, we had an opening, so he moved down to first shift, but it was a difficult transition for him, and he was chronically late. So I met with him, we set up a improvement plan. We talked about things he could do to show up on time, and ultimately we had to terminate him. And he was someone I really liked. I knew about his life situation. He told us, he brought in pictures of his baby, so I was someone I was fairly close to. But again, it was one of those things where ultimately it didn't work out, and he was really upset when we terminated him and blamed us for it, so the friendship pretty much ended in that one. But again, when we work with people and we see people outside of work, it's very clear that we keep our boundaries consistent once we return to work as well. Okay, what I want to turn our attention next to is stages of group development. Anytime a group goes through a change or starts or becoming a new group, it goes through very distinct stages, 4 distinct stages: forming, storming, norming, and performing. When you become a boss or supervisor to former peers, the group dynamics change, and that's what we're going to be talking about now over the next few minutes, is how these things change and what your role, what the group is going through, and what your job should be as the manager. So the first stage of a group is forming. When a group forms, and think about groups that you've joined or as a new person, or just kind of what they went through. And as a group forms, there's discomfort of a new situation. People are generally polite but somewhat impersonal. There might be some discomfort in the new group. People are guarded. There's generally some new testing of the situation or a leader as people get to know one another. There's some anxiety. People are asking themselves, or if it's you, where do I fit in? The group is fairly dependent on the authority and hierarchy of the leader. People might be skeptical about joining this group because of past experiences with the group or leader, wondering, are things going to be any different this time around? And the people are trying to find their own place and establish their own identity in the group. So again, when we talk about becoming a leader for the first time or becoming a leader for people you supervise, people are going to be, even though you know these people, there is going to be some discomfort of the new situation, and there's going to be some testing of you as a new leader. People are going to see how you're going to manage. So what is your task as a manager? As a manager in a new group, it should be you should be fairly directive. We need to be clear about what our expectations are, which we talked about earlier. Tell people what you want them to do and what you'll do. We need to set very clear goals and visions. We only get one first impression as a manager, though people may know us previously. We only get one first impression as a manager, so we want to make it count. We really want to set the tone. We also want to do what I call as a team assessment. We want to diagnose the group and the people in the group. And what I mean by that is we want to look at the strength of this group. What stage is the group in? How did you as the manager enter the group? Was it from the outside? Were you moved up? Were you a peer that's now their supervisor? What happened to the previous manager? What has the group recently gone through? How long have they been together? Also, did someone else within the group also want the position that you're in? Is the group fairly seasoned, or are they fairly green and new? What are the strengths and weaknesses? What is the morale of the group? So again, what I mean by a team assessment is really taking a critical look in your new role as the strengths and weaknesses of each member of the team and as a team overall, and then you can decide where you need to intervene most effectively. The second stage is storming. Storming is there's tension and conflict in the group. We use the term adolescence. For those of you who have raised adolescents or have adolescents, that can be a very storming period. There can also be a lot of creativity in this group. People are basically learning where they fit in. They're challenging authority. The group may lose some of its initial enthusiasm. The morale may dip. They may feel, well, this is just another meaningless group. People may also begin feeling frustrated and angry around goals if we're not accomplishing them fast enough. Groups frequently get stuck here. There's a lot of storming going on, and if the manager's not really strong with getting the group out of this stage, this is where groups frequently get stuck. So what are the manager's tasks? Managers are still quite involved at this point. We're giving directions, telling people what to do and how to do it, but also beginning to solicit suggestions. We're setting clear limits and boundaries with employees. We're learning to say no. Communication continues to be paramount. We're role modeling what we want people to be, or how we want them to act and resolve issues. We want to raise issues and resolve conflicts. We also need to realize that conflict is okay. Les Brown, motivational speaker, says conflict is okay. It's just important that we ride out the turbulence. That turbulence is part of what the path we take to achieve our higher performance. Managers must continue to push the group along. We don't want to get stuck in this stage. For those of you who have seen the movie Apollo 13, you'll remember the scene where we have everyone around that table with all those different parts. The group's kind of storming, trying to figure out what to do. If that group stayed in that storming stage, then the astronauts never would have returned. So it's our responsibility, our job as a manager, when we have a group that's storming, to get them to move beyond that towards some type of resolution. A good example of this, I have two daughters. They're in their 20s now, but when they were much younger, they were playing softball. And we had a new manager one time, or a coach, and he asked the team, he said, in the first meeting after the first practice, we're going to decide on a team name. Well, with a handful of 18, 15, 14-year-olds, that became a pretty chaotic, wild process as people yelled out loud different team names. So this is a group that was in their forming, storming stage, and a better approach from the coach at this point was probably much more of a hands-on directive approach, and maybe say, these are the three different names we get to choose from. I'll give you all a piece of paper and we'll vote on it. So again, early on, we want to be much more hands-on and directive. The third stage is the norming stage. The group is beginning to figure out how to work together. We're starting to accomplish some goals. There's increased group order. Role expectations are clear. There's increased satisfaction. The group is starting to be more open and giving feedback to one another. They're not afraid to raise issues. They're starting to roll up their sleeves to get the work done. And then there's a greater sense of team identity. The manager's task here is to support, encourage, and praise, reflect on the group's process and progress, give lots of feedback, allow the group to take some risks but observe closely, communicate trust in a group of people. Show respect. Begin to let go and do some delegating. Think about teaching your child to ride a bike. At this point, you're kind of hanging on. The training wheels are off, but you're going to let go every now and then to see how they do. An example of this was when my training team was working with the ICU department. They were talking about retention strategies, and the group came up with all the retention strategies because they knew each other pretty well. They were starting to form together pretty solidly as a group, and they were bringing up the ideas. So the supervisor then just had to really, agree with them and say, whether we could do them or not. But the group was really starting to make decisions. The fourth and final stage, for performing, here we have a climate of support, productivity and morale increases. People are working for the greater good of the team, not just themselves. There's a lot of focused energy. Bear Bryant, the legendary coach of Alabama, said the group is focusing or working with one heartbeat. There's a lot of sharing of leadership. The group is much more flexible and adaptable. Employees are enjoying their jobs. They're showing increased confidence. And as a manager, this is where you begin to delegate. Your role becomes much more to guide. You let go, but don't give up the responsibility. This is where your beeper goes off a lot less when you're not around. The manager is able to get away from work in your employees and trust that the group is going to perform and do a good job. You as the manager is still in charge, but you're starting to let go and delegate. So again, for those of you that have been part of a group that's performing, or as a manager of a group that's performing, this is where it gets to be fun and a lot easier to be a manager of that group and focus on some of the other things you need to do. As you go through the stages, you can see the progression from telling employees to do, to showing them what to do, to coaching them up to success, allowing some risk-taking by the employees, observe closely and provide lots of feedback, delegate but don't abdicate your responsibility, and give lots of praise and support. So these are just some of the things you can do as the group is moving through the stages. And what we're looking at in this diagram is the 4 stages, but realizing that the group really can go from any stage, from forming, storming, norming, performing. You can get stuck in stages, you can skip stages, you can move from one stage to the next. So for example, you may have a group that's performing, and then you have a new hire, they join the group, that changes the dynamics of the group, and you may drop back down to a performing stage, but that might not last too long. Then you go through a storming stage before you get back up to performing. So again, the group will go from stage to stage, back and forth, depending on the changes that are going on within the group. And it's our job as a manager to, again, get groups and teams of people, our department, our unit of responsibility, up to the performing stage. This is just a summary. It's a nice graph to kind of look at. Again, you can see the performing stage, forming, norming, and storming, and then just some of the dynamics that are going on with the group. The flip side of that is the same stages, but now you see what the manager's tasks are in each of these stages. Again, this is just a good reference slide to have. And I encourage managers that have been doing this for a while, if you can't figure out why your group's not getting along, getting things done, it might be good to go back and look at this, and it's like, what stage are we on and what's going on? What do I need to do differently to get us through this? This is just a slide that summarizes the entire thing. So again, we're not going to go over this, but you can see the 4 different stages up here, the key issues, the key concerns, the things you do as a manager, and the leader's task. So again, just another good reference slide. Let's talk now a little bit about leadership styles. There are 4 different types of leadership styles: directing, coaching, supporting, and delegating. These are for Ken Blanchard, again, the 1-minute manager. In the directing stage, the leader provides specific instructions and closely monitors each person's task. In the coaching, it's more of a showing type of thing. The leader continues to direct and closely monitor a supervisor task. Supporting, the leader is more facilitating the task. And delegating, turning over responsibility. And leadership style is a combination of both directive and supportive behaviors, from being very clear and hands-on to telling people what to do, to being much more supportive and listening for what people do. An example of this would be, I had someone who was a brand new training specialist, and he had the assignment to create a training for a department that called in. And this was fairly new to him. He was an excellent trainer in front of a class, but actually putting it all together was something brand new. So we met every week, much more of a directive style. As I saw that he was pulling this together and uses the resources and the team of people around him, it became much more of a coaching, supporting style. And as he got to the point where he's very competent in this, it was delegating, where someone would call up and say, we'd like to work with one of your trainers around the project, and I could delegate it to him. But again, it was getting someone up to this level. So if we look at this grid here, we look at what the development style of the group is, and we have to fill in what would be the leadership style that we would use for a group of people who are low competence but high commitment, to someone who's high competence and high commitment. So you can see, again, a group that is low competence but high commitment, we want to be very directive. Think about a team of people who are really committed to doing a good job. For example, a basketball team, but they're not very competent yet. We need a much more hands-on directive style versus a team who's highly competent, the last one, and highly committed, where we can turn things over much more. So again, this is just another way of looking at how our leadership styles, depending on the competence and commitment of the group. So when we think about situational leadership, it's our ability to change our leadership style depending on the person you are working with and the task at hand. And it's important for the leader to use more than one style with different employees and or a different style with the same employee for a different task. So, for example, if you're working with a nurse, the nurse may be clinically strong, and therefore you can be much more delegated, but might need improvement with customer service skills, and you need to be much more hands-on with that area. So that's just an example where you can use a different style with the same person. I had clinicians, mental health clinicians, who were excellent clinicians. They were really strong working with clients. They knew their clinical stuff. But when it came to talking to clients about collecting fees, they were much more uncomfortable with that. So my style there was much more directed or hands-on style. So it's important to know that we should have the ability to flex our style depending on, again, on the person or the team and the task at hand, realizing that people are more competent and committed in different areas. And it's more important, going back to team assessments, to know what those areas are to make us effective, to make them effective. So again, in summary, the 3 skills needed for leadership is the flexibility, the ability to change our style, diagnosing our team. I can't stress this enough. I worked with a lot of new supervisors who went in there and didn't spend a lot of time knowing their team. Talked about, diagnosing and assessing your team's strength, and then contracting with individual people on specific goals that you would like to see them accomplish and that they would like to accomplish. This slide talks just a little bit about the difference between a leader and a manager. It can be summed up in a couple things. If you look at all the job descriptions in your organization, you'll find one for a manager. You will not find one for a leader. And if you look at the italics on the bottom, a leader is one who inspires people to do the right thing in a timely manner, whereas the manager is one who directs people to do things right in a timely manner. It's important also to realize, even though you may have the title of supervisor or manager, you may have an informal leader within your group. It's important for you to address that issue if it becomes a problem. The informal leader can be your greatest advocate, but it can also be your greatest thorn in the side. And if it's the latter, if the informal leader is a thorn in the side, it's really time to have a discussion with that person one-to-one about kind of what your goals are, what your expectations are, and map out a plan that you can hold them accountable for. Otherwise, the informal leader will take over your department. He who leads but has no followers is only taking a walk. So again, assessing your team, this is a tool that we borrow from the Healthcare Advisory Board, and it's a way of looking at our employees and comparing the risk to lead the organization against the impact. And it really helps us look at engagement and strength of our team. I really like this tool. So in summary, what this tool is, and you can use this, is across the top you'll see when we think about impact, what we're looking at is the impact of someone from our team leaving. So if that person were to leave, is it going to be a high impact, a medium impact, or a low impact? And again, against the vertical axis, are they a high risk to leave or a low risk to leave? And what you do is you plot all your employees on this graph. And if you're not sure what their chance to leave is, or their risk to leave, or their impact of their leaving, then that's really an indication that we need to spend more time with our employees. The ones that are most concerning is those employees that fall in blocks 1, 2, 3, and 4. Those are the highest risk to leave and also have the greatest impact if they were to leave. And if those are the people we want to retain, we need to think about ways that we can retain these people. It's also said that managers should not be surprised if someone were to leave. So if someone leaves our department, our unit, our team, and we're surprised by that, and maybe we're not checking with people as much as we need to. So again, this is a tool I've asked people to use before. We used it a lot in trainings. It's a really good way to see if we're checking in with our employees and we know the impact. Now, of course, someone might be a high risk to leave but a low impact, and that would be okay. Those that are a low risk to leave, which means we don't think they're going to leave, but that, and they're a high impact employee, then, our strategies would be different for them as well. But again, it's blocks 1, 2, 3, and 4 that we should be most concerned about. This is just some indicators that people might be a risk to leave: unexplained absences, people who used to be highly motivated or less so, life-changing events, spouses may move, they may have kids entering school, going to college, maybe a new baby, performance issues, that would be a flag that someone might be at risk to leave. So some strategies, again, what we want to do is match up the strengths of our employees with the task. One of the cool things my department did in the learning and OD areas, they would go off-site a couple times a year and talk about all the different activities we had in our department, and they would split them up for people who, and really try to match up, people who like to do this class or orientation but had less interest in this other class, so they would split up, and it wouldn't be fair. It would be fair and equitable, but it wouldn't be even. So some people might be teaching more orientation classes, but less so another class. So trying to match up people with strengths. We also want to recognize people. Everyone wants recognition at every level of the organization. Listen to what really motivates our employees and try to retain those employees. And some of you might be familiar with the Gallup organization's Q12 questions. Basically, the Gallup organization developed 12 questions that correlate highly with the financial success of an organization, retention, patient satisfaction, and productivity. And I'm not going to read all these questions. You can find this online as well. But basically, employees want to know they're important, that what they do is important, that what they do at work is important, that there's an opportunity to learn and grow. That was one of the biggest retention factors for our ICU nurses, the ability to learn and grow. People want to know that someone is important, cares about me. Again, going back to positive management assumptions. And that they feel connected to their team. I was talking to someone at another hospital recently, and she said she works in HR, and she went into work one day. She says, I really thought about calling in sick, but I knew I had some interviews scheduled, and if I called in, then someone else would have to pick it up. We'd have to reschedule. And she wasn't really, really sick, and she could get there, but she said, what really made me motivated, and her hospital uses the Q12, is I really thought about what my impact would be if I didn't come in that day to the rest of my colleagues. She felt a real commitment to be there with her colleagues. So again, the Q12 has the Gallup organization has a lot of information if you went online about this, but these questions link very highly with people being engaged in an organization. Again, you've probably heard these terms before. There's 3 types of employees: engaged, not engaged, and actively engaged employees. Those that are engaged are highly motivated. They're committed to their team, the organization, the mission and value of the organizations. Those that are not engaged might be people who are formerly engaged but are less so now. Again, we looked at some of those risk factors. And the actively disengaged, those are people who really aren't going to leave your organization because they really want to be there and get their paycheck and really cause disruptions. These are people that you should be most concerned about. The Gallup organization estimated that there are 22 million actively disengaged employees that cost the American economy up to $350 billion per year in lost productivity, including absences, illnesses, and other problems that result when employees are unhappy at work. So again, the actively disengaged are very concerning employees. For those people that are engaged, for the engaged employees, you can see over on the right-hand side some of the things that we can do as a leader to keep people engaged, basically giving people responsibility and recognition, giving them opportunities to learn and grow, to keep them motivated. I had some person who I was always worried about leaving my department. She was very skilled. She handled our learning management system, but she knew it so well that the vendors would call her and ask her questions of how to solve things. They've asked her to do presentations for other people who use the same system. She was a test site for new products, but I talked to her frequently about her satisfaction with the job. I knew she could get a job at a similar, doing the similar thing for another industry at much higher pay, and I didn't want to lose her. She was really good. What ultimately happened with her, because we continued to talk over the years, is when the hospital purchased an HRIS system, a human resource system, she took over and learned that whole new system and then gave her previous responsibilities over to someone else. So she was really engaged, and I didn't want to lose her. For the person who is not engaged, we need to sit down and talk to that person. Are they burned out? Are there certain things we can do to help them get re-engaged? Get this person away from complaining to back to solving problems. And usually it's little things over the years that person might have felt slighted about, not listened to, and they just started to just back off and do, they continue to do their job, but not with the level of enthusiasm and engagement that they did before. Our responsibility, again, taking action, being proactive, is to find out what's going on with this employee, and if it's somebody we want to retain, to talk with them about how to retain them. The actively disengaged is the person that may require some type of progressive discipline, PIP, and we really need to work to get this person out of the organization again, because most likely this person is not going to leave on their own, but they're going to cause a lot of disruption. Jack Welch, when he was over at GE, he was the CEO of GE, and he started a practice which is done by other companies where every department manager had to get rid of the lowest performing 10% of the organization every year. So it made you basically very critically look at all your employees and what their performance level was, and then to terminate those that were performing at the lowest level, basically saying those people are not helping our organization, our department, and I just want the highest performers here. And it works the first couple of years, but then again, it gets much more difficult to balance once some of the people who left needed to leave, and you have a group of high-performing people. But again, the actively disengaged employee rarely leaves on their own, and it's something we usually need to manage out of the organization. The last section I'm going to talk about is the 8 universal laws of leadership, and these are leadership principles that you'll find effective if you're a seasoned leader as well as a brand new leader. The first one is maintaining absolute integrity. This is the root law, and it covers all other laws. Integrity means doing the right thing regardless of the circumstances or benefit to the leader. And as you can see, I bolted out 4 ways that you can maintain your integrity. You keep your word. You do what you say you're going to do. We talked about this earlier in terms of setting the expectations. Setting the expectations for your employees, but also telling them what you're going to do, and then sticking to it. Choosing the harder right over the easier wrong, guarding your principles, and again, doing the right thing. And doing the right thing is sometimes challenging because there's going to be pressure for you to do things that might be a little bit easier, but you want to do the right thing. This is a slide from the Franklin Covey organization that was done in 1999. They surveyed 54,000 employees and said, if all of these different qualities, what do you find most that you want to see most in a leader? And you can see integrity far outweighs anything else. I mean, almost double, probably double what communication is. So even though these other competencies are important, people want to follow a leader who has integrity. If you think about yourself, you would probably agree as well. Those are the people you want to follow and go to work for every day. The second law of leadership is knowing your stuff. Followers don't want to follow leaders because they're good at office politics. They want to follow leaders because they're good at what they do. You want to know your people, therefore you maximize productivity. We talked about this earlier in terms of a team assessment. Knowing the strengths of your employees, what they do best, and trying to match that up with what they do every day. We want to learn from the bottom up. We want to become an expert at every job we hold. So as we take on different positions over the years in the organization, we want to take those skills with us into our new position. We want to be a learning machine. We talked about this earlier. Learn from every experience. Don't be afraid to ask questions. Again, it's okay to learn from your subordinates because they may know stuff that you don't know. And then never stop learning. We talked earlier about the importance of continuous learning. Take on projects, take on new assignments, read articles, go to conferences, find out what the best practices are. Never stop learning. And as you do this, you're going to role model this behavior in your employees, and then you're going to create a whole department that wants to be the best by continuing to learn and be on the forefront. So again, best practicing, knowing your stuff, and getting better. We're not going to spend a lot of time here earlier because we talked about this earlier, declaring your expectations, which is really communicating and setting boundaries. The foundation of effective leadership is thinking through the mission of the organization, defining it, and then setting a clear path to get there. We want to be very clear about what our expectations are. Here we say choose, don't juggle, whereas in the first slide we talked about juggling. Dr. Charles Garfield says that we, as a manager, we want to choose but don't juggle our priorities. We want to hold all our options up against each other and then choose the one that we want to focus on. So again, even though our role requires us to juggle lots of things, we want to choose where we spend our time and making sure it's value added to the organization. We want to develop a plan and write it down. It's more likely to occur and happen if we write a plan down than if we just say we're going to do some things. Make our expectations compelling. We want people are going to follow us if we're passionate about what our expectations are. We want to listen to feedback and adjust our strategy because even though we may have a strategy, we may find some things along the way that's going to help us adjust our strategy and go in a different direction. And lastly, we want to be faithful to what our expectations are. Again, going back to if we tell our employees we're going to do something, we want to be faithful and hold true to what we're going to do. The Marines, for those of you that are familiar with it, have a saying that's called Semper Fidelis, which means always faithful. It doesn't mean sometimes faithful. So again, as we declare our expectations, we want to be faithful to them. We want to make sure our expectations are clear and compelling. We want to be a leader that people are going to want to follow. The fourth one is showing uncommon commitment. It proves that the goal of it is worthwhile and it's really important. It proves that the leader is not going to just quit. So in terms of being showing uncommon commitment, we want to meet people face to face. We want to make a commitment about a public commitment of what we say is important. We want to keep going when the going gets tough. I know, for example, when we started a lot of focus at Northside Hospital on increasing patient satisfaction and creating patient satisfaction culture or patient service culture, that we were doing off-site retreats, and we had a lot of negative feedback from employees. They didn't want to go to this. They said it was the flavor of the month. There's a lot of resistance, and we just kept going, and we had the retreats, and we kept back and doing them. We had more people come. And eventually they saw that the organization was very committed to this, that the trainers were very committed to this, and that was something we were going to stick through even when the going got tough. We want to think outside the box if we need to. We want to accept the risks that go with commitment. Tom Peters, he's a management guru, and he also says that we don't want risk-averse managers. Risk-averse managers are managers who are trying to collect all the information before they make a decision, and what ultimately happens with a risk-averse manager is they don't make a decision. They're spending so much time collecting information, it's almost like a paralysis, and they don't make a decision. So as a manager, remember, we talked about the importance of taking action. We're in that role because the organization expects that we can handle that role, and part of that role means we weigh out the options, we take acceptable risks. Again, we don't want to just go carelessly down a path, but we do want to be able to take a risk and make decisions. When I talk about meeting employees face-to-face, there's a really good book out there by Captain Michael Abershoff. He writes a book called It's Your Ship. He took over a ship that was one of the lowest performing ships in the Navy, low morale, high turnover, poor quality scores. People just weren't really wanting to do their job. And he turned that ship around in 1 year. So he had a bunch of disengaged employees. And what he did is he met with every employee face-to-face, found out why they joined the Navy, how he could help their career in the Navy, how he could help their career outside the Navy, what supplies they needed to be successful, started to give them the responsibilities, and really found out a lot about each employee. Again, going to the team assessment, he turned that ship around where it was one of the highest performing ships, and he did it within a year. So showing uncommon commitment. Expect positive results. We want to develop a positive self-confidence. We want to follow people who are positive. People want to follow people who are positive, so we want to develop a self-confidence. We want to visualize the results we want. Again, this is a technique that's used in and outside of industries. A lot of athletes use it, but think about the results you want in terms of your team, about your performance of your team, about quality scores of your team, patient satisfaction scores, and visualize the results you want. We also want to maintain your enthusiasm because things are going to get tough and challenging at times. So we want to surround ourselves with winners. Les Brown, who's a motivational speaker, he talks about surrounding yourself with people who are going to keep you up when life knocks you down, because life's going to knock you down. He says you do not want to hang out with or surround yourself with what he calls toxic people. So again, you're going to be around people, you're going to encounter people who are going to be naysayers. They're going to tell you why things can't be done, what's wrong with things that are being proposed. You want to maintain your enthusiasm, and as you do that, as you're a positive thinker, as you visualize and communicate the results you want, your employees will follow you as well. You want to take care of your people. You want to be a leader when things go wrong. There's a story of Malden Mills, which is a factory that burned down around Christmas time. The CEO of the factory continued to pay the people while they rebuilt the mill, and also gave them Christmas bonuses. Now, we're not always in a position to do that because we're not the CEO, but we do want to take care of employees when we can. We want to reward and recognize employees. Again, remembering that everyone wants some type of recognition. We want to share the game. We want to be absolutely equitable in how we treat employees. Again, we don't want to show favoritism, whether it's about job assignments, shifts. We don't want our personal relationships to get in the way in terms of how we manage. We also want to give respect. We're going to get about maybe 2 to 5% of respect just because of our title. The rest of it we need to earn, and that's okay. This is what we're talking about, is earning the respect of our employees. We want to share the game when things go right. We want to take responsibility when things go wrong. Number 7, putting duty before self. We want to focus on what the work mission, the strategic goals of the hospital are before our personal gain. We want to rejoice in the success of other people. We want to celebrate milestones in projects, celebrate milestones in people's lives, show people we care about them. We want to consider that people have a family outside of work and try to be supportive of giving people time off, flex time, making sure people have time with their families. If you consider yourself first all the time, then people are going to see you as an ineffective leader. An example of this is think about the situations we have them here once in a while in Atlanta where you have a snowstorm. People still show up for work when there's a snowstorm. The expectation is that hopefully the manager is doing that as well. In terms of duty before self, I remember talking to a vice president of HR one time, and she was late for our meeting. She said she was out in the parking lot counting parking spaces because they were getting ready to build a new parking deck. They had to make sure they knew exactly how many spaces they needed. And granted, she could have delegated that task, but she was out there with her team of people counting parking spaces. So putting yourself out there as well. And lastly, we want to get out in front. We want to be where the action is. We don't want to be a manager who is just sitting back in our office and expecting other people to do their job. When the Olympics came to LA a number of years ago, Peter Ubroth was the CEO who brought him there. He was out there meeting with vendors every day, meeting with contractors, talking to people about schedules. So we want to be out there all the time with our people. We want to be out in front. Again, we don't want to be doing their job, but we do want to be out in front with people all the time. We want to be a leader that takes charge, makes decisions, that sets the positive example so that people have something to follow. Again, the 8 universal laws of leadership. Without action, the universal laws are worthless. And we talked about that again earlier, about the importance of accepting our role, communicating our role, setting clear boundaries, and lastly, we talked about the importance of taking action. So when we think about dual relationships and balancing our role as a leader and a friend, as a leader, we can still be a friend to those we used to supervise. However, you must be a leader first. If you try to be a friend first, it will be much more difficult to be a leader. This is just some information about resources used for this presentation and just contact information about myself. Leslie, we only have a couple more minutes, but if anyone has a question or comment, please feel free.
Yes, and if anybody has a question, you just need to press *# to be able to speak since the lines are muted.
And again, if you don't have a question or something you would like to share right now, you think of something after the presentation, or if you view the presentation later, that is my contact information. Feel free to get in touch with me either by calling or by sending an email.
Thanks, Pat. And I have one quick question for you that I thought of. So I'm now a supervisor of my old friends at work, and now they're not as friendly towards me. How should I handle that situation?
And that's what Leslie just mentioned is not an uncommon dynamic. People who were friends with you before may be a little bit standoffish. Again, we talked about the stages that groups go through. They see you in your new position. They may be a little bit more reserved, maybe a little bit more testing. I would approach them, remind them that, we had a friendship you would like to continue, but that your role at work has changed. Set some clear boundaries, what it's going to look like at work. Remind them of what it can look like outside of work, again, within the limits that you're not going to be able to talk to them about work kind of things or information that you're privy to, and hopefully that relationship can continue. I've had lots of success with that and examples of that over the years. Because you don't want to just give up your friends, and people may become a little distant from you and waiting for you to make the first move.
Okay, thanks, Pat. Does anybody else have any questions? Pat does have 2 more upcoming webinars in October, and those call topics are achieving your highest priorities and increasing patient satisfaction scores. And if you'd like to register for any or all of our upcoming webinars, please visit our help registration website. And I do encourage everyone to take our new online Zoomerang survey. And if you'd like to receive ACHE Category 2 Continuing Education credits, you must complete the online evaluation and indicate that in question 10. And I will send out a survey link to all of the people that registered for this call and the people that took the poll. And if you could please forward that on to anybody else in your organization that participated and would like to receive ACHE credits, that would be great. And I'd just like to thank Pat for the great presentation. And if there are no more questions, you're free to go. And please contact me if you would like the PDF slides or a playback information or any other information. And my email is in the chat box currently. Thanks, everybody.
And I would like to thank everyone that participated in the call this afternoon as well. I appreciate your time. And again, feel free to contact me if you would like.
Thanks.
Thank you.
Audio recording for this meeting had ended. The meeting is now